Hi everyone, I'm Dr. Evelyn. Let's talk about lameness. Lameness is a medical term for limping. Limping can be caused by a number of things, which is why it's important that if you see your pet limping, that you take them to the veterinarian for an evaluation. Potential reasons for limping can include some type of sprain or soft tissue injury, muscle injury, some type of ligament injury, possibly a broken leg, a developmental issue in young pets, potentially even tumors can cause limping if there's a tumor in the bone. So cancerous processes can also cause limping. And sometimes even a disc problem, basically a problem with their neck or back, can cause a pet to limp as well. Since there are a number of causes for limping, it's important to have your veterinarian perform an orthopedic examination, which is a thorough examination of all the bones, the spine, and the joints, so that they can further narrow down the potential causes for your pet's lameness. Once your pet has an orthopedic examination and they localize where there's potentially pain or discomfort, or maybe they palpate something abnormal, they can then move on to recommend diagnostics. Different diagnostics that we use to identify causes for lameness would depend on your orthopedic exam and also our physical examination. Let's say your veterinarian felt an abnormal swelling on the leg. Potentially it could be a sign of a tumor, or if it's involving the joint, maybe there's a ligament issue. If it's a toe, it could be a broken bone. At that point, your veterinarian may recommend an x-ray to take a look at the bones and maybe some of the soft tissue structures like the ligaments in the joints to see if there's any abnormalities. Other potential diagnostics that we can run, sometimes we can use an ultrasound to look at the joints themselves, look at the muscles if we suspect there's something unusual or there's a lump or a growth. X-rays can also be useful for looking at a spinal issue possibly. X-rays will usually give us some indication if there's any kind of potential abnormality with the bone itself. Sometimes if the lameness is caused by a disc issue and an X-ray looks normal, your veterinarian may recommend more advanced imaging like an MRI or CT scan, and that typically is done at a specialty hospital. They'll give you information on referral hospitals to have those advanced diagnostics performed. Once your veterinarian has performed their examination and diagnostics, then they can look at the treatment option. Lameness typically suggests that your pet is in pain or discomfort. So a doggy is not necessarily going to cry if they have pain or discomfort in their bones, their joints, their back, but they will show signs of maybe not putting as much weight on the leg. Maybe they'll wince when they, step down. They might be reluctant to jump or run like usual. So those are signs that there's pain, and a lot of times that's where we direct our treatment. For more details on pain management treatment, please refer to our pain management video so you can get a little more insight on what the options are. Today I'll cover a few different things that we can recommend. Typically we'll start off with medications if indicated, either a non-steroidal anti-inflammatory or a specific pain medicine like an opioid-based pain medicine to make sure that your pet's comfortable. In addition to that, we may recommend some other non-conventional pain management modalities like acupuncture or laser therapy to help reduce pain further or help reduce inflammation, help the body heal itself, especially if there's an acute injury that might have caused transient pain and discomfort. Sometimes if we diagnose arthritis on an x-ray as a possible cause for lameness, then we'll talk about chronic management for arthritis, and a lot of times we'll also recommend supplements that can also help improve the joint health. For more information, call us or book your appointment online at petsadena.com.